on page acute renal failure 723. There's somebody who's dialysis technician here. Who is it? Go on, you do dialysis. No dialysis technician? Normally in the class there's always a dialysis person. So this becomes easier for you. Okay. So welcome to renal disease. C'est ça yo ele med surge. Med surge. Med surge. Renal. We're going to start. Yesterday we did the diagnostic test. We're going to start on page 727. Acute renal failure. Renal disease means renal have a problem. Renal failure meaning kidney no good. Did y'all get that? In acute renal failure, that means Shannon doesn't have a history of renal disease. She woke up this morning and her kidney no good. Our priority is not to fix the renal failure. The priority is to fix the cause of the acute renal failure. Did Shannon do drugs? Did Shannon drink? Is Shannon diabetic? Something is going on with Shannon. Any question? In acute renal failure, grave rive avant. English, the worst happen first. If I have diabetes and I go into chronic renal failure, what will happen is my PP will be clear, my PP will be light, and then my PP will be dark. That means in chronic renal failure, worse is last. Acute renal failure, worse is early. NCLEX question. Again, acute renal failure, plus grave la rive en vent. So, okay, Miss Sonia, I don't understand that. Let me give it to you again. Acute renal failure, the patient is on dialysis today. Chronic renal failure, the patient is on dialysis later. Any question? Acute renal failure, grave, worse, happen now. So let's go in a box with acute renal failure. It is page 729. This box, you're going to go, I cannot go to NCLEX without this box. Okay? In acute renal failure, there's 3 phases. Allergic, what's that? Allergic, allergic in English, PP in small, very little. In chronic renal failure, chronic polyuria first, the last stage allergic. In acute renal failure, allergic happen first. Any question? Acute renal failure, it is sometimes fixable and treatable. If Shannon do heron, once we remove the heron away, do dialysis on Shannon, she should go back to normal kidney function. So let's go. Shannon is in acute renal failure. That means she woke up and her kidney shut down. She's a crack addict, whatever. She's on drugs. Ready? Allergic phase. Excuse me. Her BUN is elevated. Aha. Creatinine is elevated. Her specific gravity is what? Decrease. Her potassium is high. Class, give me Shannon EKG. PP? No. Her potassium is high. Flat P, tall T, no U wave. Now, Shannon potassium is high. We will give Shannon what? Cancellate or insulin. Good job. Shannon will be on dialysis. Because I told you, acute renal failure, the worst happened what? First. So NCLEX asks you, how's her potassium? High. How's her calcium? Low. How her phosphorus? High. When calcium is low, phosphorus is high. Where did I teach you that? Fundamental electrolytes. You got it? Okay. Diuretic phase. Her potassium is low. Give me the EKG. Tall P, flat T, U wave. So what must we give her? Potassium. And the last phase is called the what? Recovery. You must know this. They ask you, give me all that apply. Potassium in allergic phase, high. Sodium is what? Low. Remember, it's shift. You need to know what happened in an allergic phase. You need to know what happened in diuretic phase. And you need to know what happened in what phase. And that is for what? Acute. Any question? You give regular insulin. Now, Miss Sonia, the second disease is chronic renal failure. That means chronic renal failure means you got diabetes for 30 years. Your kidney no good. Okay. All I need you to do is to read the box on page 730. You see 730? When the patient has chronic renal failure, all these things happen. 731, 732, 733 is all on page 730 in that little box. You see that green box? Box 52-6. The reading is on 731, 32, 33. Students don't like to do all that reading, so we're going to do one big reading on page 730, box 52-6. That green box, that is for chronic renal failure. So far, Miss Sonia told you acute and chronic. Now, chronic renal failure, P grave, happen last. The worst happen last. Chronic renal failure. What all systems are involved? Well, let's go. When your chronic renal failure, neuro, seizures. I'm on page 730, box 52-6. The patient has seizures, slurred speech, asteritis. Let me tell you what asteritis is. Now they boot man. Look, the hand flap. When you go put Sonia, write my name, Sonia, on the board, I do ziggy line like a kindergarten. That is hand flap. Okay? Tremors, myoclonus, ataxia, paresthesis. Anytime a patient is in renal failure, chronic renal failure, the patient, you must initiate seizure precaution. Any question? A type of seizure. Then we go into cardio. Anytime a patient in renal failure, you got cardio problem because you are retaining what? Fluid. And something wrong with the potassium, right? So you hypertension, peripheral edema, heart failure, uremic pericarditis. Uremic, it's uric acid. You remember I talked about that. When a patient in kidney failure, bonjour, en créole, on can mettre ou prend Vaseline, petroleum jelly, Vaseline, ou passer sur lui. Patient still going to be ashy, dry. Ou can prend graisse, ou passer crème, yo tout blanche. That is called a uremic frost because there's garbage in the blood. Uric acid. Because when you do dialysis, that is what you're cleaning, the uric acid. Right? Uric, they itch. They have uremic pneumonia when they talk to you and they breath smell like poo-poo and sugar together. See, halitosis is stank breath. But where that stank breath come from is if you ate onion, that is halitosis. You ate onion, your breath stink because of something. When you have, right, what they call factor hepaticus, that means your mouth stink from inside. And they don't smell cause it to come out. People who have AIDS. People who have liver cirrhosis because liver and kidney are husband and wife. When kidney go bad, liver go bad. When liver go bad, kidney go bad. So they have what we call factor hepaticus. The breath, not halitosis. Halitosis is stank breath because of something. At least if you go wash your mouth, the stink breath will go away. Ça même, it don't go away parce que ou malade dans les dents. It's from within. They call it factor hepaticus. Poop and sugar. Sweet. That means from inside on the down pagoon. Right? People with AIDS got this. Right? Any question? We cool? Okay. Uremic pericarditis, pericardial effusion, heart, cardiac tempomate, and also their heart stretches. Okay? So when you have chronic renal failure, you got neural problem, you got heart problem. Then you got respiratory problem. There's a lot of water in your lungs, crackles, depressed, cough reflex, shortness of breath, uremic pneumonia, too small. There you go. Why? Because the stomach's so big with fluid. You remember, the kidney not working because the kidney doesn't filter. So sang gonpli pil garbage là-dedans. The blood has too much garbage, right? So that means the kidney is not working because of uric acid. The purpose of the dialysis is to remove the garbage that's in the blood. That is why when you do dialysis, you see the stomach go down. You got it? Okay. So this patient got respiratory problem. This patient had bleeding problem, anemia. So anytime you are in chronic renal failure, an early sign, oliguric phase, in acute renal failure, the patient got all these problems. Listen to what I say. Chronic renal failure, these problems happen late. Acute renal failure, these happen early. You got it? Okay. Now, this patient, anorexia, nausea, metallic taste in their mouth feel like metal. That's why they eat a lot of sweet stuff. A kidney patient always, you go in the room, you see nothing but sweets. You know why? The mouth, there's no taste. It tastes like metal. And they said they got bone pain. Girl, can you go give me some medication? So the doctor, morphine, Lyrica, they got bone ache. Okay? Uremic colitis, diarrhea, diarrhea, santi. Right when you walk in the room, they breath stink, the poop stink, they in the room by themselves, they moody, they could commit suicide, their stomach is big, their leg is skinny, their pee-pee is small, and their memory, they like, stomach really big, and ashy, white as snow. That is the uremic acid. And they go diarrhea, constipation, diarrhea, constipation. They go the uremic factor. Ça c'est bouche. Stinking breath. Stomitis, diarrhea. Here it is. NCLEX question. Urinary. Listen. When you have acute renal failure, how's your PP at first? Oliguria. That is an acute. Oliguria means PP thick, PP rouge. Little, thick, and it's red. Let me tell you something. In late chronic phase, chronic renal failure, late, if you PP on this wall, there is no bleach will take that PP off. PP rouge, it stick to stuff. It's so thick and it stink. In chronic polyuria, and polyuria and look like a soap, soapy, cheme, right? Foamy is early sign in chronic renal failure. Late sign in chronic, the PP is red. Acute renal failure, it don't even be foamy. It's red. You understand what I'm saying? So chronic renal failure, early is polyuria, late is what? Oliguria. NCLEX question. You got it? So yesterday, what test I would do for a patient with kidney?
BUN and creatinine.
BUN and creatinine's blood. Got that. What machine test? What about the urine? What about that 24-hour urine? 24-hour urine. Of course, BUN and creatinine. Now, how would the creatinine be? High. $2, $3. Remember, 3.2. $2, bad kidney. 0.05, good kidney. Cents, good kidney. $1, bad kidney. Any question? Anytime your creatinine is elevated, NPOB, NG2B. NCLEX question. Anytime you come in the ER with creatinine elevated, NPO, NG2B, lavage. NPO, I stop eating. The doctor shut down everything. The only thing they would do is maybe give you IV fluid, nothing by mouth. Okay? Now, skin, dry skin, pruritus. You see uremic frost, mais c'est pas gratté lié, well, you gratté. But ashy, how you say ashy en créole? Blanchi, les moun a besoin crème. Pas gon crème qui arrive ça. Même Vaseline. Now, I'm very ashy, I'm itching. What, are you going to use hot water or cold water? Because hot water make you what? Itch. Itch more. Now, are you going to use a towel to wash me? No, your hand. because the towel irritate my skin. Pruritus means gratter, itch. Okay? Ecchymotic, uremic frost, that is late. Yo, blanche passe samgone, they real white. You give them a whole thing of lotion, it ain't gonna work. That's the uric acid. Okay? Now, then we go into multiskeletal. Remember, Miss Sonia said they have pain. Guys, they do. And when they walk, you can hear like almost like you, Poppy, sit down. And they sew off the marbles. Where am I? Who are you? What? Ma'am, you said the same thing. Sir, can you sit down? Oh, okay. I'm sorry. Oh, I'm sorry. It's like the same thing because the mind is going. All right? Remember, they got neural issues too. Bone pain. And they are fertility problem. If you got a mate that got kidney problem, kidney failure, you just bought a brother. They can't do nothing. And you'll see stomach big, pee-pee very small, deteriorate. No good. No pee-pee, no nothing. I mean, it's down. Impotent means pakakisa, travail. Decreased libido, frequent, if it's a woman, you got period problem. On joue formé, on joue pas formé. You one time you got period menses, amenorrhea. You have it. It can come this month, hell, next month, no period. Okay? Any question? So you see, this is, now I didn't say this is kidney disease. I said this is what? Failure. Any question? All right. Good. Now, here is what you pay me for. We're going to go to page 734. Right? 734. Anytime you have acute renal failure or chronic renal failure, we will do dialysis. We will do dialysis. Stay with me. We will do dialysis. Right? There's two types of dialysis. One the patient do at home, and one Vitas do for you. Right? Or you go to university, whatever company, Vitas, what are the other companies? So the one that Vitas do for you is called hemodialysis. Hemo. Guys, the phone going off now. We need no phone. Still going on. Okay? Somebody phone here. Okay? Hemodialysis. That's the one Vitas. Stay with me. Okay? Now, that's the one Vitas. That means you go to an agency. You go somewhere to do it. Now, anytime you are doing dialysis, you do not have to be a registered nurse. It's good to be a registered nurse because it's more money. When students cannot pass LPN, they cannot pass NCLEX, they give up, they become a dialysis technician. They get paid the same amount of money as LPN. You work for Vitas as a CNA. Vitas train you to do dialysis. I have a lot of students that are dialysis technicians and make good money. That's when they can't pass the test. right? So hemodialysis is VITAS. Hemodialysis, you either do it 3 times a week, right? They sometimes 3 times a week, or sometimes they do it weekly. If you do it 3 times a week, you don't do Monday, Tuesday, Wednesday. You go Monday, Wednesday, and Friday, or Tuesday, Thursday, Saturday. Why? Because you got to be careful. What is dialysis, Miss Sonia? Listen to that. I'm taking this blood from her body. I'm putting it in a machine, which is taking all the garbage out, and I'm putting it back into the body. Imagine if I took the blood too fast, I can kill her. So you got to be careful. So let's go intervention for hemodialysis. You're going to go to page 734. E. You're going to put NCLEX next to E. Dialysis, you don't need a consent, but you need an order. The doctor have to tell you how much I want you to take off. So the doctor gave the order, 2 liters, 3 liters, whatever. Here it is. What is my nursing intervention for hemodialysis? Be careful. There's 2 types of dialysis. I didn't even put nothing here yet. I'm here. This is the one you got to go to a facility. I just use VITAS because that's who I know. Now, here's what you do first. Ready? Hold blood pressure medication. Hold because it causes hypotension. Hold vitamin. What are your water-soluble vitamins?
Vitamin C.
Is it A, D, E, and K, or is it the B's? A, D, E, and K? Hold your vitamins. Why? Why? You're going to lose it anyways, and what? It wash off. There you go. Hold that. Ready? Digoxin. Hold it. You going to take my vitals before, during, and after. Before, doing, and after. Anytime I'm getting dialysis, my temperature will always be a little high. Please don't call the doctor. You may get cussed out. The temperature will be high. If my blood pressure is too high, slow it down. If my blood pressure is low, reposition me. Again, if my blood pressure is high, slow my machine down. If my blood pressure is low, reposition. You take my BP, doing, before, doing, after. Can I eat? Yes, I can. African American who's getting dialysis will say, no, I don't want to eat, because African Americans don't like to see blood. Caucasian, they eat. Can you bring me a steak? Nasty, because this is blood. All right? Any question? But the patient can eat. Yes. It's number 10. Patient can eat. Yes, ma'am.
Yes, I was wondering why we have to hold ditch.
Okay, the digoxin interfere. Let me explain to you with the digoxin with potassium. And first of all, the digoxin has a level, 0.5 to 2. And anytime you give the digoxin, first of all, you got to look at the level, and you got to look at what is going on with the patient. When the digoxin, when it's low, too much, your potassium is low. When it's high, when the dig level is high, right, potassium is high. So the reason you're holding it is because the potassium. You don't want the patient to go into heart failure. Okay? Let's continue. Now, Assess the client for fluid overload. If blood pressure is high, that means it's going what? Too fast. Okay. Weigh the client before and after NCLEX question. Why? You want to see if you took amount what the doctor ordered. So if Carol was 200 before and after the dialysis, Carol is 220, something is wrong. Or if Carol is still 200, that means you didn't take off. So you got to weigh Carol, the patient. Okay? Now, there you go. Listen to this. You remember, I'm taking the blood out of your body and I'm putting it in a machine. What about if the blood too thick? Oh. So sometimes you may have to give the patient heparin. Sometimes you got to give the patient blood. Because nobody's want blood like Isa. We need the blood to be able to not be so thick or it'll be difficult to pull it. You understand? So anytime you're doing dialysis, which labs you will check? Uric acid, and you will check H&H and PTT. Not PT-INR. PT-INR only go with Kuma? All right. H&H, PTT. Guys, we have to be able to pull la sang. We need to be able to pull the blood. Yes. Of course. Because if hemoglobin is low, patient anemic, qui sont pay pour m'bagen sang. Qui sont pay laver m'bagen sang. The patient, you need to watch the patient for anemia. And the doctor will order the blood. You got it? Okay, continuing. Monitor for clots, monitor for hypovolemia, and check electrolyte. Hey, you see that electrolyte? Especially that doggone potassium. Anytime you're giving dialysis, potassium always high. Always high. And that's why you give them insulin. You got it? You can feed them. Now, here it is. When you doing dialysis, especially the Vitas one, I need to make sure the port is patent. So you need to hear bruit and thrill. So when you touch it, you should hear the noise is loud. Now, NCLEX asks you, what does the port call? Right? I didn't, school didn't teach me this. I had to go in the real world. You either have a Quinton or a Tessio, which is 2-port. You either going to have a Quinton and a Tessio. You see, when a dialysis patient comes to the ER, baby, you better put an IV in them. If you use their port, they're going to say, don't use my port, because if the port no good, they got to be hospitalized for you to put another one, for the doctor. So anytime you're a sickle cell patient, you're a dialysis patient, and you have a port, either it's a Huber port, or it's a Quentin, a Tessio, RN, or PN. Well, not PN, RN. They come into the ER, don't use my port, put an IV in me. And they'll cuss you out too. Don't use my port. It's covered with gauze and tape, so you don't use it. And let me tell you something, and the doctor will, home health care, those who doing home health care RN, every month, they may want you to go flush it with what? Heparin. To keep it what? Open. And when you go flush one of these, the people need to pay you $65. I'm telling you, RN. Certain things, when you do home care, don't be getting no little money. Wound vac, you need to get good money. Vancomycin and put heparin. Something just simple, they need to pay. When they just dress and change, 26, take it. But big stuff, the insurance company pay them extra for that. A Vanco, the insurance company pay the facility $2,500, and they pay you $26 an hour. Now, baby, you gotta know what you worth. When I did home health care, I killed them. Oh, you want me to do a wound vac? Okay, $115. You want me to go on? You gotta know what you work. Students, oh, okay, I got a job. Yay, $20. $19. Okay. No. You gotta know what you work. Oh, Vanco, they pay you more. Is it Medicare? Boy, you got more for that. You ain't gonna pay me no $20 to go hang no Vanco. Vanco, you gotta sit there with the patient till it's finished. So you work more. Y'all didn't know that, huh? Talk to them. You don't have to be rude. You just talk to them like you know. Because people will use you. Because you don't know. Well, you don't know. I'm going to pay you whatever. But if you say, hey, Vanco, ma'am, you got more than that. No. Yesterday, not today. All right? Okay. So, now, so that's where it says access for hemodialysis. Here's the port. You have to hear bruit and thrill. Any question? Bruit and thrill meaning the port has to be open. Who got for dialysis now? Wait, no. You cannot put an IV on that same arm and you cannot take vitals. No, the opposite. Y'all know that, right? Boy, some LPN out there in the working field, I feel sorry for you. And don't be an LPN and all you do go to people's house. You're not a real LPN. You need to go work rehab. And don't be no damn RN, you working in a rehab. I understand a job is a job. I'm not knocking nobody's job. You need to be an RN and work in hospital. You see, when you are RN and you work in the rehab, they call you Klebish out there in the real world. They say you don't compare to this person. You need hospital. You get your license, you find a hospital that's going to put you a student nurse. They pay $19, you take it. When you got wings, you out. You go to telly, you go to big stuff. But you don't get your RNA fair rehab. No. Come on. Know what you were. When you get the license, come talk to me. I'll tell you where to go. Wellington, they got a student. JFK, Del Rey, student nurse. Yes, they pay nothing. You don't care. Your goal is not to go stay there. Your goal to do 1 year. Hey, okay, goodbye. Not rehab. I'm supervisor. Rehab. You got to know what you want. Right? When busy teacher, right? Right? When Bible came. No, you work something. Know what you work. Jesus. Anyways, let's go. When you have hemodialysis, there's 3 complications that occur. 3 complications that occur. Anytime you have hemodialysis, I'm making y'all bad, I'm sorry. Because nobody will tell the Haitian community nothing. So I'm trying to educate y'all to get y'all body. You got to be a hustler. See, you can be from Haiti and still Americanized. You know, you got to know your rights. Let's go. Okay. Complication of hemodialysis. That means anytime you have VITAS dialysis, if you don't have a ride home, I will not do it. Anytime you do hemodialysis, you must have a ride home. Why? Because after dialysis, you loop. Only the hemo dialysis. They call it what? Dialysis Encephalitis. Loop, 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 loop. It's the last one. It's C737. Anytime you got VITAS, you at risk for something that is called dialysis encephalitis. So NCLEX asks you, it's 737C. I started that first because that's the number one NCLEX question. They say after dialysis, what's priority? Safety. Student never take it. The students say, boy, what safety have to do with dialysis? Hemodialysis. You gotta lock the door. Or you put them here, you find them on Jog Road down the street, naked in the street. After hemodialysis, patient tends to be loop-loop. That's one complication, right? The second complication is called Disequilibrium Syndrome. Here it is. Let me tell you what happened. So I'm doing dialysis on Susan, and guess what? I remove the blood too fast, or Susan was having a problem, I stopped the blood. I just killed Susan with VT. I just killed her. Why? Because I stopped the machine, what? Too quick. So she go into what? VT. Disequilibrium syndrome means that's why dialysis, you don't do it too fast and you don't stop it. Let me explain to you. The first thing, Susan having complication, you slow down. You reposition Susan. You give her oxygen. If all that don't work, then you stop it because you didn't have what? Choice. But you don't go stop it quick because you will kill Susan. Why? Because you pull the blood out of her. You're not God and you go pull blood out of people too fast. Number one reason why dialysis technicians go to jail. They texting patient on dialysis, the machine going too fast. And dialysis is money. Let me explain something to you. The machine is washed for 2.5, 3 hours. The machine. The dialysis is normally done 3 to 4 hours. So one patient right there, there's 8 hours, right? Some RN so greedy because they pay them either $45, $55 an hour. Some RN try to do 3 dialysis patients a day, no good. There's only 8 hours. There's 8 hours, right? There's 24 hours in a day, but 8 hours, 8 hours. I can see you do 2 dialysis, but you're fat. Why? That means the machine doesn't have